Do you take care of the hair down there? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to talk about it openly. Why do people have pubic hair? And when did grooming in that area become common? How many people actually do it? What risks are involved and how can you stay safe? And finally, what should you do if you end up with those annoying ingrown hairs or rash-like bumps? If you'd like to learn about this and enjoy some of the most helpful educational content on YouTube, be sure to subscribe and share this channel with your friends. So why do humans have pubic hair? First, it's a sign that the body is mature enough to have children. You don't develop full pubic hair until you go through puberty, which means your body has reached the stage where reproduction is possible. In simple terms, it signals that someone has reached adulthood, which, from an evolutionary standpoint, is important. The second reason is protection from friction. Pubic hair can help reduce rubbing in that area, especially during intimate activity. And the third reason is that it plays a role in releasing pheromones. Hair-bearing areas like the pubic region and the armpits release certain lipids, proteins, and pheromones. Pheromones are chemical signals the body produces that can influence another person's response. For instance, the scent from someone's pubic area might trigger attraction or arousal, particularly around ovulation when those chemical signals may shift. Interestingly, in ancient Egyptian artwork, women were often shown with small triangular patches of pubic hair. Archaeologists have even found tiny golden razors buried with them, believed to be tools they would carry into the afterlife. During the Middle Ages, removing pubic hair was sometimes encouraged as a way to prevent the spread of pubic lice. It wasn't until 1866 that a painting called Laurine Dumont showed a vulva and pubic area with natural hair. Later, in the 1950s and 1960s, it was believed that pornographic films began avoiding visible pubic hair to prevent censorship. At the time, regulators argued that showing pubic hair made material clearly pornographic. To avoid that label, performers often kept the area trimmed or closely groomed. So who is actually grooming today? Studies done on college populations show that around 88 to 90% of both men and women groom their pubic hair in some way, either partially trimming it or removing it completely. If you ask women why they remove their pubic hair, the reasons can vary. Some say they do it to feel more sexually attractive. Others feel it improves their sense of femininity. Many believe it looks cleaner or more hygienic, and some even feel that grooming enhances their sexual experience. For men, the reasons are fairly similar. Many say cleanliness is the main reason. After that comes sex appeal, and finally, body definition. And for a lot of men, you might notice that when the pubic hair is shaved, the genital area can appear slightly longer. But how often do people actually run into problems after removing pubic hair? In many studies, shaving has been shown to be the most common method people use. That makes sense because it's inexpensive, easy to access, and most people already have a razor at home. However, research also shows that using a non-electric razor is linked to the highest number of complications related to pubic hair removal. So, how can someone get injured while removing pubic hair? There are several possibilities. For example, waxing can sometimes cause genital burns. It may also lead to severe skin irritation, and in some cases, what doctors call post-inflammatory hyperpigmentation. That simply means the skin changes color, often becoming darker or reddish in the irritated area. Cuts are another concern. Small cuts on the skin can increase the risk of sexually transmitted infections if someone has intercourse while the skin is broken. Most commonly, doctors see small cuts, rashes, and sometimes pain in the area. In one study that looked at emergency room visits related to genital grooming, researchers found that these cases increased about 5 times between 2002 and 2010. This rise is likely connected to the growing number of people grooming in the United States. The researchers also found that about 83% of these injuries were linked to shaving with a non-electric razor, the typical razor many people keep at home. Interestingly, about a quarter of women in the study experienced injuries related to waxing burns, cuts, or even injuries inside the vaginal area. For men, injuries from scissors were more common. Men were also the only group reported to have injuries from hair clippers, while women were more likely to have issues related to waxing products or shaving creams. In another study, researchers noted that although grooming injuries do occur, only about 3% of them were considered serious. That's encouraging news. With proper technique and care, most people can avoid significant problems. There is one important warning, though. If you have diabetes and it is not well controlled, you need to be especially cautious. Personally, I would strongly advise avoiding shaving altogether. The reason is that shaving can cause what may seem like a small cut or injury. But for people with poorly controlled diabetes, even a minor break in the skin can lead to a very serious and potentially life-threatening condition called Fournier's gangrene. This condition is essentially a rapidly spreading flesh-eating bacterial infection. When it occurs, the infection can progress very quickly, making someone extremely ill in a short amount of time. It often requires emergency surgery to remove the infected tissue, and in many cases, that surgery can be quite extensive and dangerous. Because of this risk, I strongly encourage anyone who is immunosuppressed or living with diabetes to avoid shaving methods that might cause cuts or breaks in the skin. Now, let's talk about ingrown hairs, why they happen and how you can prevent them. Ingrown hairs can develop in two main ways. The first occurs when a hair is shaved, especially if you shave against the direction of hair growth. When that happens, the hair can be cut at a sharp angle. As the hair grows back, particularly if it's curly or slightly wavy, it may curve back toward the skin and become trapped underneath it. Hair normally grows out through tiny openings called follicles. But when the hair grows into the surrounding skin instead, the body recognizes it as something that doesn't belong there. This triggers a foreign body reaction, causing a raised bump and inflammation that can be uncomfortable or even painful. The second type of ingrown hair can happen after waxing, tweezing, or plucking. In this situation, a new hair begins growing from beneath the skin. If there is a thick layer of dead skin blocking the surface, the hair can't break through properly. Instead, it grows sideways within the follicle, which leads to the same kind of irritated, inflamed bump. One frustrating part of these reactions is that, for some people, they can lead to what doctors call post-inflammatory hyperpigmentation. That simply means the skin may darken after the irritation heals, leaving behind noticeable discoloration that can be bothersome. One of the best ways to reduce the risk of ingrown hairs is to shave in the same direction that the hair grows, rather than shaving against it. I'll also share a few more helpful tips in just a moment. Another condition you might see is called folliculitis. This isn't always caused by an ingrown hair. Instead, it happens when the hair follicle itself becomes inflamed or infected. Sometimes it looks like a small pimple, and in some cases, you may even see a bit of pus. When that happens, medical treatment with antibiotics may sometimes be necessary. So let's talk about how to remove hair safely, and what to do if you end up with one of those irritating ingrown hairs or rashes. Whether you're shaving pubic hair, legs, or underarms, the first step is to make sure the skin and hair are wet before you begin. Next, always use a clean razor. Avoid using one that has been sitting on the shower ledge collecting moisture. Razors left in damp environments can become dull or rusty. Even worse, they can develop mold or bacteria, which you definitely don't want anywhere near your skin while shaving. It's also important to use some type of lubricant. That could be soap, shaving cream, or another gentle product designed for shaving. Lubrication helps the razor glide smoothly across the skin and reduces irritation. And finally, remember to shave in the same direction the hair grows. This simple step can greatly reduce the chances of developing those uncomfortable ingrown hairs. And if you tend to get ingrown hairs often, keeping the area well moisturized can really help. Ideally, you should replace your razor about once a week, especially if you shave regularly. A dull razor can cause uneven shaving, which increases the chances of developing those frustrating ingrown hairs. Whatever moisturizer or gel you plan to use, it's smart to test it first on a less sensitive part of your body. Try to choose products without strong scents or fragrances, and look for options made for sensitive skin. These are generally less likely to cause irritation. When it comes to waxing, it's best to visit a trained professional. If you decide to do it yourself, make sure you use a proper waxing kit rather than trying homemade methods. If the hair is too long, trim it first so it's about ½ inch in length. And before applying wax in a sensitive area, always test a small amount on another part of your skin. Hair removal creams can also be effective, but again, it's important to do a patch test first, perhaps on your hand or another small area, to check for any allergic reaction. These creams often contain strong chemicals that may irritate the skin for some people. There are also other options available, such as laser hair removal or intense pulsed light hair removal, often called IPL. I'm not going to go into detail about those today. So what should you do if you develop an ingrown hair? First, and most importantly, stop any kind of hair removal for about a month. I know that can feel like a long time, but the skin needs time to recover. Avoid shaving, waxing, tweezing, or any other method that could further irritate the area. Applying warm compresses daily can help soothe the skin and may encourage the hair to come out naturally. If you think you might have folliculitis, it's a good idea to see your doctor. They may prescribe antibiotics, especially if you notice pus or signs of infection. If you develop a rash or intense itching, an over-the-counter cream like hydrocortisone cream can help. Apply a small amount directly to the itchy spots to reduce irritation for a short period. Finally, you may want to rethink your hair removal routine. If you frequently get ingrown hairs, bumps, or irritation, consider trying a different method, or simply take a break from hair removal for a while. All right, I hope you found this information helpful. As always, remember to take good care of yourself, because you truly deserve it.